بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله. My topic today is about gallbladder stones, how to diagnose it by ultrasound. Stones are concretion located in the biliary system, and it is commonly seen in the gallbladder. It is account about 10% of population. It is common in female and symptomatic in about 20% of patients. Three types of stones noted in the biliary system: the cholesterol type, which accounts for 10% of patients; the pigmented type, which accounts for 10% of stones; and the mixed stones, which account for 80%. Here you see some types of stones after surgery. Gall Gallbladder stones can be seen in the biblium film, which accounts for about 15 to 20% of seen percent to 15 to 20% by ultrasound and by CT scan and by MRI. The gold standard for diagnosis of gallbladder stones is ultrasound. Three types of shadowing seen in the diagnosis of gallbladder ultrasound: clean shadow, which represent due to solitary stone; confluent shadowing, which represent multiple small stones; and wall echo shadow, which represent large gallbladder stones or gallbladder filled with ultrasound. Here we see some examples. This is single stone in the gallbladder with shadowing. It is a clean shadow, and the stone should be mobile also. Here is large gallbladder stones with the clean posterior shadowing, and it is mobile, and in this patient there is associated adenomyomatosis with it. Here you see multiple small gallbladder stones associated with confluent shadowing associated with gallbladder wall thickening. Here you see large gallbladder stones filling most of the gallbladder called this sign. It is called wall echo shadow sign or complex sign. The gallbladder either filled with multiple small stones with small amount of bile seen between the hyperechoic gallbladder wall and the stones, or large stones. And this diagram is explaining the findings. Sometimes we see floating stones in the gallbladder. Sometimes the stones are so small and we cannot see the shadowing, and we used other method to diagnose it, but the main diagnostic factor is mobility of this stone. Once it is mobile, it is a stone, sometimes without shadowing. Some pitfalls seen: there is shadowing from the gas in the bowel and give dirty shadowing here, and this is simulating stone. Sometimes polyp seen, and but that polyp, it is fixed, not mobile, and sometimes it is confused with stone. Sometimes gallbladder stones are associated with gallbladder wall thickening and complication, and we will discuss these findings in another topic. And thank you very much.